Hello, friends! Welcome back to Prime Wave. Today, we're diving into a topic that hits close to home for many of us: why health insurance in the USA often feels like a scam. From sky-high costs to surprise bills, we'll explore why this system is so frustrating and what you can do to protect yourself. Let's unravel this together. To understand why health insurance feels like a ripoff, let's start with where your money actually goes. If you pay $100 for insurance, you might expect that all of it funds your health care. But in reality, only about $70 goes toward your actual care. The rest, roughly $30, is eaten up by administrative costs and insurance company profits. Imagine this: you buy a $100 gift card for healthcare, but when you go to use it, you only get $70 worth of services. The remaining $30? It's like a handling fee that doesn't benefit your health at all. This sets the stage for another major issue: high deductibles. High deductibles mean you often pay a lot out of pocket before your insurance kicks in. For many plans, this deductible is around $1,500. So even if you have insurance, you might still find it hard to afford the care you need. This leads many people to skip important medical visits altogether. Now let's talk about surprise bills. You go for what you think is a fully covered preventive checkup, and then surprise, you get hit with unexpected charges. It's like ordering a meal, thinking everything's included, only to be charged extra for the bread and butter. Take Emily's case, for instance. She went for a routine checkup, confident it was covered. Weeks later, she was shocked to receive a bill for $500 for additional consultations she wasn't told about. Similarly, John got a $150 bill for lab tests that weren't included in his preventive care. This is the reality for many. But to understand how we got here, let's rewind a bit. The history of health insurance in the U.S. holds some clues. In the early 1900s, health insurance as we know it didn't exist. Employers sometimes hired doctors directly to care for their workers. The first modern insurance plan appeared in 1929 thanks to Justin Ford Kimball at Baylor Hospital. Teachers paid a small monthly fee for hospital coverage, which eventually became Blue Cross. This was a simple model, but as healthcare advanced, gaps in coverage became more apparent. By the 1960s, many seniors and low-income families still had no insurance. That's when Medicare and Medicaid were introduced. In 1965, Medicare was established to provide health insurance for people over 65 and Medicaid to support low-income families. Before Medicare, about half of older Americans had no health insurance. Suddenly, almost all seniors had access to essential medical care, which significantly improved their quality of life. Medicare initially covered hospital stays and later expanded to include doctor visits and prescription drugs. Medicaid provided crucial support for low-income individuals and families, disabled persons, and pregnant women. By the 1970s, these programs were integral to our healthcare system. As healthcare costs grew, so did the complexity of insurance. In the 1980s, managed care and HMOs were introduced to control these costs. They created networks of preferred providers and required referrals for specialist care, adding more red tape and often limiting your choices. Managed care aimed to keep costs down but made the system harder to navigate. Fast forward to 2010, the Affordable Care Act, or ACA, came into play, expanding Medicaid and creating insurance marketplaces to increase coverage. The ACA brought insurance to millions who were previously uninsured. However, it also introduced challenges like rising premiums and complicated coverage options. Many people found themselves paying thousands of dollars each year for premiums and medical expenses, despite having insurance. One of the trickiest parts of today's health insurance system is pre-authorization. This means your doctor needs to get approval from your insurance before you can get certain treatments or medications. Sounds straightforward, right? But it's often a major roadblock. Consider Sarah's situation. She needed surgery for a chronic condition. Her doctor submitted a pre-authorization request, but the insurance company delayed approval for weeks, demanding more paperwork. Meanwhile, Sarah's condition worsened, leading to more pain and additional costs for temporary treatments. Pre-authorization helps insurance companies control costs, but it often delays necessary care and adds stress for patients. It's a major hurdle in a system already full of obstacles. So to recap, our health insurance system is fraught with high costs, hidden fees, and bureaucratic hurdles. It evolved from simple, community-based plans to today's complex structure, where major programs like Medicare and Medicaid provide essential coverage but still face challenges in accessibility and affordability. What can you do about it? First, educate yourself about your coverage. Second, demand transparency in billing. And third, advocate for patient-friendly policies. Your voice matters. Share your experiences to highlight these issues and push for positive changes in our healthcare system. If you face these challenges, tell us in the comments. Your stories can help drive change. Thanks for watching. Don't forget to like, subscribe, and share this video. Together, we can work towards a healthcare system that truly serves everyone. And if you found this video helpful, hit that notification bell so you never miss an update. Let's build a community that supports each other through these challenges.